Extreme Networks joins forces with customer Promedica to converge massive network who saves up to $20,000 monthly. Healthcare is being driven by the on-demand, digitally driven way of life we've all come to rely on. Full-service urgent care centers are on the rise, especially those connected to larger healthcare systems. Patients expect more value at a lower cost and a fast care experience without the need to visit the emergency room, and they want their health information at the tip of their fingers. Promedica, a nonprofit health system servicing parts of Michigan and Ohio, answered to this need by opening several urgent care clinics with plans to set more in motion. As patients flock to highly convenient, digital-forward facilities for care, Promedica was met with the pressing need for an always-on, always-fast network, and Extreme Networks was up to the challenge. The response has been huge to our urgent care centers. It's the biggest trend we're seeing at Promedica. Because we're open 12 hours a day, it requires an extremely stable network. Patients expect to be served quickly and efficiently. But growth wasn't the only problem Extreme needed to tackle. Promedica also completed an epic electronic health records implementation, plus launched new applications for patient monitoring and a public address system, and they all rely on the network. When it comes to supporting the health of patients through technology, delivering seamless multicast is critical. Without it, if desktop dashboards in the hospital's contact center become unreliable, troubleshooting using traditional protocol-independent multicast (PIM) quickly becomes a nightmare. Not to mention, they needed network operational efficiency overall. There's no offering urgent care without urgent service delivery. Time to service and maintainability must be rock solid. Here's where the Extreme Networks Fabric Connect next-generation network virtualization technology comes in. The engineering team at Extreme worked alongside Promedica to build a simpler, agile infrastructure configured and deployed ultra-fast. Promedica's new infrastructure was designed to support much more scalable IP multicast, allowing them to forego the complexity and uncertainty that comes with conventional PIM deployments. When we first investigated the Fabric Connect story, it sounded too good to be true. There wasn't any of the traditional complexity, but it promised to deliver all the resiliency we needed. The way that it handles multicast was very exciting because we knew that we needed to do something different. Business as usual was not an option for Promedica. Thanks to engineering efforts of Extreme Networks, Promedica was met with success. They gained the ability to converge to one network instead of running one for biomedical needs and another for business needs. With the ability to connect two data centers with Extreme's transparent UNI, Fabric Connect saved the medical center from buying additional links, saving up to $20,000 monthly. Today, Promedica enjoys confidence in their network, empowered to make their vision for smart healthcare a reality while meeting the demands of today's consumers, backed by the knowledge and support of Extreme Networks Fabric Connect experts. Relief from rigid network limitations and freedom to make changes on the fly. An end to shaky reliability and excessive risk. Accelerated site setup in line with launch goals. Full access to business-ready backbone. Want to see how Fabric Connect can take your network from complex to simple? Visit www.extremenetworks.com to connect beyond the network.